From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Good morning. Welcome to Medical Forum. I'm your host, Jeff Reed, here with my co-host, Dr. Chris Marr. Dr. Chris Marr, how are you doing this morning?
I'm well, Jeff. How are you doing?
Good. How was your week?
Very well. Very hot.
It was
Although
hot.
It seems to be cooling off a bit.
Well, it looked like it was going to rain. But we have had more rain.
It was in the 80s this week, which is better than June. It was in the hundreds.
It seems like we've talked for about the last 10 shows about how hot it is.
Because it's been really hot.
It's been ridiculous. You know, I want to thank our guest, Reliable Medical. Good to have Martha, Joe, Richard, Jennifer, Aubrey, the whole gang from Reliable Medical educate us a lot with respiratory and prosthetics. And Chris, obviously, we always thank you and Colonial and the great doctors there for all the support at Reliable Medical.
Well, Aubrey and Reliable have always been a cornerstone in the Sumter community for providing great service to our respiratory patients, oxygen patients. Thomas helps out over there fitting our CPAPs for us.
One of your buds.
And absolutely. Unfortunately, I sent him over there to do a little side work for you, and he hasn't come back.
Are you trying? Let me ask you this off the record, because I don't think anyone's listening right now. Are you trying to get him back?
I'd like to get
because there's some talk about that. So just hands off. You know, finders keepers. I think it's losers sweepers, what have you. But good to have you here with me on this Saturday. And you know, one of our favorite guests that we always have on the show is Jeff Fall with Tuomey. So again, we're happy to have him. And today, he's got a compadre with him from the Industrial Medical Park in Curt, Ackerman. And I'm excited to hear some of the things that they're doing. I know in the past we've talked to them about the Smart Beat programs, and here now getting into the football season, and Curt always might even give us a couple talks about South Carolina football.
Yeah, Curt, thanks for coming in today.
So
absolutely.
Appreciate it.
Curt Ackerman, how you doing?
I'm good. I would like to say y'all are in good company.
Well, we are. Jeff Fall?
Good morning.
Yeah, Jeff, good seeing you.
I may have skewed the curve.
No. Adding to it, look, anybody other than Chris and I, it's got to be an
improvement, a step up.
It is. And for those of you listening in, we talk here in the Sumter, Clarendon, and Florence communities about all the medical issues that are going on. And we've been fortunate to have a lot of great guests on. They talk about home health, hospice, and such. We mentioned the aforementioned Reliable Medical. And today, again, we've got Curt and Jeff in the house to talk about all things going on with the industrial park. And, you know, with football right around the corner, Curt, let's start off with some of the programs that you have for the high schools, with all the wellness that you do, the Black and Blue Clinic, as I think as I remember it being called.
Yeah.
So talk to us about what's going on with the sports with Tuomey.
Well, for years we've been really fortunate to have great relationships with all the high schools, private and public. Actually, since I came to the hospital in 1999.
Wow.
Yeah.
18?
Yeah, 1899. Yeah,
okay.
Right after the war. I got bored. I needed something to fill my time with.
So 15 years plus.
Yeah, absolutely.
You're a veteran. I like it. Okay.
Yeah, and things have evolved a little bit. Back when I came in, there was really a huge need for athletic training and some weaving in of orthopedics and sports medicine within all the schools. And back then, we had relationships with Wilson Hall and Thomas Sumter, all the way reaching into Manning. And things have changed. A lot of these schools now have hired people on. I think you're starting to see that curve move a little bit to where high schools are recognizing the need to have some type of medical coverage on the sidelines or, in the dugout, whatever the case may be. But, right now we've got John Malone, who provides sports medicine services as an athletic trainer. He works with USC Sumter, he works with Wilson Hall. We have relationships with Thomas Sumter and Lakewood and Crestwood and Sumter High School, but the unique thing about those last three schools, those public schools, is they have full-time athletic trainers. Mm-hmm. So what we really offer to them is that Black and Blue Clinic that's been around, forever, and a lot of communities have that.
Well, let's talk about that.
Yeah.
Most games, high school football, Friday night, right?
Mm-hmm.
Black and Blue Clinic That's Saturday morning. Is that right? That's after we've had a little bit of Knicks, a little bit of.
That's right. That's right.
So explain how that works. I'll say I'm maybe new in town from industry, military. My son's on the team.
Right.
Playing on the team. He played either Thursday night in the JV game or the Friday night in the varsity game, and get mixed up a little bit. How does that work? Is that open to anyone?
You know, the greatest thing about Black and Blue clinics is it serves the masses. You know, when you think about how many teams are playing on Thursdays and Fridays, that's a lot of kids. I mean, and even down to the cheerleaders. So what you have to have is you have to have some mechanism to come in and really screen these people appropriately, because most of them are evaluated during the game if that's when the injury happens. So they're evaluated there at ground level. But if it's something that warrants some further attention, we have that mechanism to have these folks come in. We have X-ray tech on staff. And what happens is they come in, and again, there's an established relationship with the school. You know, it's not just for everybody. There's got to be some formalities that are taken care of contractually just to cover those things. But when people come in, we have an X-ray tech on hand who's basically walking, could be anywhere from 5 to 10 people back to outpatient imaging over at the medical park. And so by the time that the orthopedist gets there, X-rays are pulled up. Yep. Or we've got people who we feel like, hey, somebody needs to put their eyes on this. It's sort of above maybe the athletic trainer. And so really it's, I have often called training rooms, they look like war rooms.
Right.
They look like infirmary.
The triage.
Right. Because it looks like, you know, when you first walk in, it looks like everybody's stepping on a landmine. You got all the tables filled. People got their foot propped up. They got their shoulder, you got arms in slings. But it's a very efficient way to go about handling things with a level of knowledge and a level of technology that really benefits these people. And if, you know, if it's something that's a little more significant, requires some further attention, such as a ligament tear, or there's a fracture detected, you know, those things are handled to the best of our capacity then, but then the follow-up care can be organized with the orthopedist or with their primary care physicians that following.
Hey, Curt, this is located. This is the outpatient Alice Drive in Westmark. What's the physical address there, and what's the phone number? We're coming up, got about a minute in this segment. So again, we're talking about the Black and Blue clinic, which with the football players, but very good for the cheerleaders, for anybody else who actually has been there. And Tuomey offers this to come in, get a little look-see. We got physicians, we got X-ray, we're ready to go. Bunch of ice, I'm sure.
Bunch of ice, yes.
Located, give us a location and give us a phone number as we leave for this first break.
Well, we're right there at the outpatient rehab center, which is 12, I believe it might be 1250 or 1251.
15 years you've been there, just so I'm clear.
At 250 Westmark Boulevard. So I'm in the back building.
Right there on the corner where everybody gets congested.
That's exactly right. When you stop, when you're stopped right there during all the construction. But it's at the corner of Alice Drive and Westmark Boulevard, and it's that front building.
Great. And we'll be right back. I want to thank our sponsor, At Your Service Home Care. As always, go by and see them on 1250 Wilson Hall Road, 803-607-9677, and we'll be right back.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
At Your Service Home Care provides in-home personal care, including light housekeeping, bathing and dressing assistance, medication reminders, meal preparation, companionship, transportation, and assorted other assistance to continue living safely and comfortably at home. At Your Service Home Care works with your local home health, hospice, Alzheimer's and VA programs, and other providers in the Sumter, Clarendon, Lee, and surrounding areas. Locally owned, At Your Service Home Care is here to ensure you and your loved one continue to live your life with dignity and respect. At Your Service Home Care, 1250 Wilson Hall Road, Sumter, 803-607-9677. Please call, stop by the office, or visit www.ays-homecare.com and let them know how they may be of service to you and your loved one.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine, and they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
And we're back with Medical Forum on this Saturday morning in August. Saturday morning, we re-air on Sundays between 2 and 3. And we're here today with Tuomey Healthcare, Jeff Fall and Curt Ackerman. As always, Medical Forum is brought to you by At Your Service Home Care, your concierge steward guide to home care and beyond. The phone number is 803-607-9677. We did a little research at the break and trying to reorient Curt Ackerman to his address. And he's
15 years.
1215 Alice Drive, Curt.
They've been wondering why I've been showing up to Piggly Wiggly for work every day.
Apparently, it's time she doesn't have any overtime on it.
They keep telling me, Curt, it's a pound at a tire, for heaven's sakes, man.
We're gonna actually drive him over after the show. And
5 more minutes, he'll be here, I'm sure.
And show him his address.
Well, Chris, we got to be feeling very fortunate. We have him here for this show.
We do.
He found his way here.
And that was good. We gave him the right address.
Wait, I thought this was the outpatient rehab.
Yeah.
At any rate, this is a great time of the year. Football's starting. I have to say, I did a lot of sports medicine in residency, and I trained in Pennsylvania. And this was when the games were starting and hanging out in the training rooms. I really enjoyed it. The big difference is on Friday nights in Pennsylvania, I'd put jeans and a sweatshirt on. I'm not going to put. I didn't have jeans and a sweatshirt on last night.
They play football in Pittsburgh.
Yeah, they play a little bit. Yeah, yes. And they're going to play a lot this year. I promise you. So anyway, we have the Black and Blue Clinic actually going on about right now, and seeing the injuries that occurred last night at the games. Hopefully there's few of them, but it's a great program that I do some on-site coverage for some of the local teams, and that we can see them on the field, and every once in a while we have to send them in the emergency room that night, but most of the time you can ice them and get them out, get them off the field, and get them in the next day and have one of the orthopedists, Dr. Strobel or Dr. Ford, take a look at them and really see what's going on. And the greatest thing about sports medicine is you're treating patients who they want to get better. They want to be better as fast as possible.
Good patients.
And they're fantastic patients. That's the joy of sports medicine. And they just want to know when they can go back in the game. And so the quicker they're seen, the quicker they're treated, rehab, whatever, but they just want to play the next Friday night.
Oh, yeah.
And that's what your clinic does.
Yeah, and the aggressiveness of the protocols to get these folks back, that's been the biggest joy of my, career, being able to work with these folks is, you're in a very coordinated model of care for these folks. We have y'all, at our disposal. We have the orthopods right there next to us, but surrounding that are these very accelerated protocols for rehab. It's not a home therapy program. They have goals that they've got to reach. They need to be back as soon as possible, safely and appropriately. Very rarely over the last gosh, believe it or not, it's almost 20 years of working with athletes. I've run into very, very few people who just weren't really genuinely motivated to do everything they possibly can with some very intense frequency to return to what they want, whether it be soccer, football, or basketball. And it really does make our lives much easier. I mean, just in the general world of medicine, compliance, with whatever, regimen the physicians prescribe, that's really paramount. And you get that a lot with these athletes. And then, the coaches are great, as I call them, bird dogs, for their compliance with what is prescribed to them treatment wise when they're away.
Yeah.
From the
for those of you listening, Curt Ackerman, Program Director for Industrial Community Health, with Tuomey, right there on the corner of West Mark and Alice Drive. Curt, let me ask you this. We've talked about, and it's such a tremendous service of Colonial Family Practice and you guys, and as you mentioned, Danny Ford, Kurt Strobel, Dr. Zitsky, the whole 9 yards coming together for the community. Is there a charge for this, or if I'm a participant, whether I'm at Hillcrest, Sumter High, Wilson Hall, Thomas Sumter, the whole 9 yards, does it cost anything to come there?
The schools pay. There's a contractual arrangement that is handled through the school. And most people have the staff or the personnel at hand now that are employed by the school to recognize the need for it. So they will, if they're not contacted by the hospital at some point in time to satisfy that contractual arrangement, they typically will seek it out. They'll say, look, we need some coverage, and or we need some help, or we need some guidance. It comes in a couple of different shapes and forms, but most of the time it's considering the availability now of athletic trainers, and really Colonial Family Practice does a lot with the schools on the sidelines, live and in person. What you see most of the time now is people just saying, I need access to that black and blue clinic, because they need answers. And, it really provides the physicians and the trainers and everybody involved with great information. So that's what you see, but there's got to be that arrangement. And in that there's consent, because again, it's, the duration of, football or basketball season or what have you, you're treating the masses. So you don't have people coming in and registering as a patient, individually. It's like, well, I'm with Crestwood. Okay, come on, back. Right. And then the next 5 people that come in, well, I'm from Wilson. Okay, come on back, because we've already got paperwork, consent, and all those things taken care of. So, but there is a relationship, a contractual relationship where, there's a nominal fee that is paid by the school.
Okay. Let me ask you this. So now I've come back Friday night, I've gotten injured, a twisted ankle. Let's just use something minimal, I guess, Dr. Marr. I come in on Saturday, it's diagnosed, maybe even do an x-ray to see, nothing fractured, but it is twisted. Here's what we got to do. And, of course, we want to get back on that field as quick as possible. And as we talked about the compliancy of an athlete who's striving to get back quicker than maybe the normal citizen. Do you set up then appointments after that Saturday? Do you say, okay, you need to be in here Monday, Tuesday, Wednesday, what have you? And with that, does a cost come out of it? Or, again, we're still covered under that same first appointment umbrella? Does it come to my personal insurance? Right. How does this work?
The only time you're gonna fall into sort of a regular patient type scenario that would jump out of that arrangement, that black and blue arrangement, is if you've got to get an operation, or when it comes to rehab, if you are tied to Tuomey, then under very just sort of traditional circumstances, Curt, your ankle sprain, we can handle this, that's all covered. All of a sudden, if the doctor looks at a scan and says, hey, there may be some tendon involvement, hey, there may be this, there may be that, then, the follow-up care with the orthopedist in office, that's a little different. There's a charge with that. You become a regular patient there. If surgery is in the future,
right,
then obviously those things
great. So, again, what a tremendous service that Tuomey brings to us. Curt Ackerman, Program Director with the Industrial Park Community at Tuomey Home Health. And when we come back, we'll bring Jeff Fall in to talk about some of the things that are going on with they're always active foundation on things they help us with. So we'll be back right after this.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
I was Daddy's girl. He was my guide, confidant, and friend. We cooked out, fished, and talked about everything. He has trouble remembering those times now. I'm the parent and caretaker to my dad. He does remember losing his dignity each time he needs my help with simple daily care. Calling At Your Service Home Care was the best thing I've ever done for my dad. His personal attendant provides assistance with bathing and dressing, a compassionate presence for his safety, and even travels with our family. Having At Your Service Home Care working with me now gives my dad his dignity, and I can enjoy just being his daughter again. The wonderful people with At Your Service Home Care have the gift of caring for your loved one. If you have become the caretaker to a parent like me, contact At Your Service Home Care, 803-607-9677. Located at 1250 Wilson Hall Road in Sumter, or visit the website www.ays-homecare.com.
This is Medical Forum, presented by At Your Service Home Care.
And we are back with our third segment here on a Saturday morning. Thank you all for listening in. It's Medical Forum. I'm your host, Jeff Reed, with my co-host, Chris Marr, and our great guest from Tuomey Home Health. We heard in our first couple segments with Curt Ackerman talking about the Black and Blue Clinic, which is very active, especially during the football season here in Sumter with all the football going on. And, you know, I want to think while we talk about insurance and we talk about healing, stop by and see your friends at Bynum Insurance, especially coming up here now with the re-enrollment with Obamacare. Stop by and get all the information. We've talked about this on the show before, how important it is to utilize their agency. Karen Schwartz is an absolute expert in vectoring you through some of these insurance problems and how to maximize your potential, and also understand the doctors that are local that will be of concern on which policy you choose. So go see them. 469-3030 there on Wilson Hall Road. Look for that big clock. And Jeff Fall, great to see you on this Saturday morning, sir.
Good morning. Good to be here.
Good.
I think we should.
Again.
I appreciate Jeff pushing his golf game off for a couple hours.
Well,
only for you.
Honored.
Only for my favorite
honored. You know, I will tell you real quickly. You know, his team. There's a great church tournament. And they won it last year with Jeff Fall anchoring the tournament. And I guess prior commitments did not allow you to attend this year. I'm not going to try to, because I know the other guys on your team, particularly one guy. The team did not win. And I'm not great at math, but plus you first, minus you not first, right? Okay. So anyway, it takes no genius to figure out the missing equation. But hey, thank you for coming in. Of course, Jeff Fall, the director of the Tuomey Foundation. And what we're talking about golf. Let's talk about it. October will be here pretty quick.
October 9 is coming fast.
Yes. and of course the great Tuomey Foundation tournament. Is this the 15th year?
This is the 17th
I always say
year.
15. Because I think I've
17
attended
years.
15, so I always personalize it too much.
Yeah, and speaking of winning tournaments, you have a pretty good record with the Tuomey Foundation tournament.
Yeah.
Jeff does.
Let me tell you.
Jeff does.
I'll watch the humility.
I think he called last week and said it's 2 E's in Rehab.
Yeah.
He said something to the,
Yeah.
to the engraver.
I'm gonna tell you something. I know that I'm the least one in that. I think it was a team effort. How about that, Mar?
Always a team effort.
Team effort. There's no Dustin Johnson over here.
That's right.
Well, tell us about it, though. October 9th. It's been moved back a week because I believe with trying to support out at our air base a little bit. A little conflict.
Did. The past few years, there's been a little conflict with a event that they have out at the base honoring all the airmen and the folks in the Army now as well. And that's been the last Friday in September. And I think that's a national day, so they're not able to change that.
I got you. How many teams are we looking for this year? We still got 8 o'clock tee time?
Yeah, we're still doing everything in one session.
Okay.
Not a morning and afternoon like some tournaments do, but we would like to fill it up. You know, that's about
about 36 teams.
36 teams is just about as many as you can do. I think last year we had 34, and we're able to get through it in about four hours, so not too bad.
We got Pete Flanagan out there leading the charge.
We got Pete Flanagan. I hope he'll come. He did not last time because of that conflict that I just mentioned. You know, our good friend Les Thompson is now heading up that committee, and Curt's on the committee with us as well.
Great.
So we're making lots of plans. We've got a lot of new surprises we're going to have for the players. And we just ordered the shirts. Hopefully we're going to have some celebrities. I've mentioned that before. We're not ready to announce who they might be, but we've invited some.
Well, tell us about some of the sponsors. I know you've got some great sponsors that help pull this off. And for those of you who have not played in it, you're missing it. It's the best tournament in town, bar none. The prizes are outstanding. The food is outstanding. As you mentioned, making the loop in 4 hours and some odd minutes is sometimes unheard of. It's on a Friday, so take time out if you're not involved in it. And I think people can sign up as an individual. Do they need to do it as a team? And we'll find you a team.
We will take it any way you want to. We have teams. The price for a team is $1,250, and that's how most companies or individuals participate. But anyone who would like to play, just contact us and we'll work it out. We're pretty easy to deal with.
Well, and some of the tremendous prizes. I know last year
we had over 100 prizes.
Absolutely. Big screen TVs.
Yep.
People walking away with that. I know 2 rounds down in Old Charleston, which was tremendous. A lot of gift certificates at the club. I know the course will be in great shape.
Yeah, we had a nice bag, some wedges, putters, lots of trips.
Yep.
A lot of our local partners donate lots of nice items. Our presenting sponsor this year is going to be our good friend Guido Hobie, M's Kimmy. They're always good partners for us. They've been a big supporter of the foundation and our golf tournament over the years. Wells Fargo, Sumter Transport, of course, Tuomey Hospital. Lots of local companies put in teams. Way too many to mention right here.
Right.
But we have so many supporters that come back and play. Many of these teams have participated in all 17 of our tournaments, so that
speaks cool. Right there.
We normally start the morning by raise of hands of everyone who's played in every tournament. It's a lot of people that'll have participated every year.
Very good. Very good. Something
I want to mention also before I forget, our local golf courses here in town also support us, and they're great partners. Crystal Lakes, Carolina Lakes out at Shaw, and Beach Creek. They participate. They lend us some of their golf carts and help us out with that, because we actually have we use more than is available there at Sunset. We stress all the resources when we have that many people playing at once. Chick-fil-A provides breakfast for us. Arby's provides lunch, and the list just goes on and on.
So you come out, we've got breakfast at 8, we tee off, we make a loop in 4 hours, which is tremendous. Anyone who has played golf to be able to get around. On the course, you're going to be getting sandwiches and such, as you mentioned, from Arby's. Then you come in, and the country club always blows it out with a great meal, buffet meal.
Grand finale and prizes.
And then 100 prizes. And the grand prizes, everyone, seems like, what I like about it, walks out with something. So it's just a tremendous tournament. And we're coming up on the end of our third segment. And when we come back, we'll continue to talk with Jeff, and then we'll bring Curt back in and talk some more about the industrial wellness. Good. And we'll be back right after this.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Brooke Luce, Admissions Director with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And we're back on this Saturday morning. Please remember that we re-air on Sundays at 2 to 3 if you've missed any segments, any portion of the program that you'd like to listen to again, as well as on our website, At Your Service Home Care. The website is ays-homecare.com. We actually have a link to all of the radio programs. So if there's any particular topic or subject you'd like to listen to, they're all labeled on the website, and you can pull up the audio files and take a listen. We'd like to thank our sponsor, Reliable Medical, who generously sponsors the show each week and is readily available to take care of all of your medical equipment, respiratory, orthotic, and prosthetic needs. So go see Aubrey for your respiratory needs and Richard for your orthotics and prosthetic needs. We are here this Saturday morning with Tuomey Healthcare, Jeff Fall and Curt Ackerman. And Jeff, we were talking in the break about a new scholarship that is going to be implemented for some nursing students, local students in town. Tell us about that.
Yes, I'm happy to announce that we've been working on this for several years, but we just are ready to implement for the first time the Dr. And Mrs. Wendell Levi Nursing Scholarship Endowment Program, and we're going to administer that through Central Carolina Technical College. You know, they're good partners with us. We got a big scholarship a few years back and helped renovate that building downtown on South Main and made the nursing center there with Central Carolina. So the next step in that, there's always a shortage, and Dr. Moore, I'm sure you can speak to that, of nursing students and nurses in our market. Dr. Levi was a long-standing physician in Sumter, spent his whole career here, and he and his family have been very generous to the foundation. But a few years ago, they donated money and set up an endowment to start a nursing scholarship program. And we wanted to invest that money for a little while and get the corpus up to a level where we could sustain it and provide scholarships indefinitely. And so we're at that point. We spent some time, Dr. K. Rhodes on our board helped us formulate the committee and all the particulars. And again, we're doing that with Central Carolina. There's a couple requirements. You have to complete your first year of nursing school. You have to have a high GPA. You have to live in the Sumter, Lee, or Clarendon community. And you have to plan to work at Tuomey once you graduate. So with those things in mind, then Central Carolina will select the students that qualify for that. So anyway, in summary, what it ended up being is 3 nursing scholarships. We'll do that each year at $1,000 each. Dr. Levi had 3 nurses that were really close to him and worked with him over the years, and these scholarships are in honor of those nurses, and they are Fair Edmonds, Elizabeth Calkins, and Frances Driver. And so it's
Very
pretty
nice.
cool that the Levi family set that up, and then they're honoring some long-standing nurses that were at Tuomey for many years, and we're going to be able to provide that scholarship assistance to those students from now on.
So,
And
Jeff, if I'm a
hopefully-
1 year, I just met the criterion. My first year, I just finished. I'm listening out there, and I've got a very nice GPA, and I want to do it. Do we call the Tuomey Foundation? Do we call Central Carolina? How do we apply for this and
You
get the
call
information?
Central Carolina,
Okay.
and they will already be advertising that to the students. So I'm pretty sure every student in the nursing program will already know about it, and they will apply if they qualify for that criteria. The most important is probably the GPA, and it's pretty high. But we also know that most nursing students carry a real high GPA, so it really doesn't exclude many students from applying.
Oh, it's great. Is once I then complete my degree, Tuomey's waiting there for me.
Right.
Needs and wants great employees, great nurses specifically, and there it is. So what a win-win for everyone.
Yep, we hope so.
Great deal. Great deal. Well, Kurt's, we talked about the black and blue.
Mm-hmm.
And, Jeff, thank you on that. And everybody
Yes.
support the golf tournament. And, boy, wow, Dr. Levi, great physician here in town. And that's just another great service that Tuomey's working. And what I like about what you guys do with that is you work, like we've talked about many times, with whether it's a reliable medical or a colonial family practice, or with the high schools, Curt, as we talked about. And now you're working with Central Carolina. So always giving back to the community, YMCA and
Collaboration.
It's just a win for
Buzzword.
everyone.
Yeah.
And I'm glad that we have the voice to let people know, because sometimes, specifically with Tuomey, we hear it's always about the court case or something. Forget about that. Okay, we get that. That been beaten to death, and we'll get that all figured out. It's all the great things that you guys do that either you don't publicize it as much because it's more, we'll just go do it, and we do all these things behind the scenes, but
Right.
all the, as being a nonprofit organization and then supporting all the nonprofit organizations that really would be extinct without you. So thank you guys for doing that. And Curt, back to the industrial medicine. I know we talked about the football and the clinic and all that. Talk to us about the industrial medicine.
The industrial medicine and wellness facility has been around since 2002. It used to be married to an urgent care facility, but really it was formed largely out of feedback that our administration had gotten from the industrial community. They really wanted a medical facility that only treated workers' compensation cases. And at the time, I was still back in the rehab department in sports medicine. And I had developed a relationship with a lot of local employers, whether it be the plant manager or the CEO. And while I didn't really enjoy this particular title, if you will, but I sort of became a great workers' comp guy. If they had a shoulder injury or a back injury and that sort of thing, I think it certainly wasn't because I was doing anything special. I just think I had a relationship with people and they could reach out to me and talk to me. And, really, Jeff, rehab, maybe 20% of it is actual,
hands-on.
Well, it's pain relief, it's swelling control, it's all these things. It's regaining a range of motion. But really, most of it revolves around prevention. And so what I really began to digest was the importance of, getting these people back to work once these things happened. And but if I could somehow move the thought process to saying, listen, why don't we just move some prevention out to your work site? What is it worth to y'all mentally and financially if we could help you stay away from us?
And we're coming up on our next to last, I guess this is our next to last segment. We'll have one more segment, and we want to talk about prevention. Dr. Morrow, you and I, for many shows, have talked about prevention as much to cures and such like that. But as we come up on our last break, I want to thank our good friends at Tri-County Home Health on 2560 Tahoe Drive. Give them a call at 905-3510. Great with hospice, great with home health and medical equipment. And we'll be right back to talk with Curt more about prevention.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
This is Brooke Luce, admission instructor with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Reliable medical equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street, voted best prosthetic and orthotic business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
We are back with our last segment on Medical Forum. Thanks to everyone joining us here on this Saturday morning. And if you missed any of the show or you just want to catch the show again, please listen in on Sundays from 2 to 3 we re-air the show. We're here with Curt Ackerman with Tuomey Industrial Wellness. He's our community health leader over there off of Westmark and Allison. Jeff Fall, of course, the Tuomey Foundation chairman. I want to thank, as we move into this last segment, At Your Service Home Care, for being a great presenting sponsor on 1250 Wilson Hall Road. Give them a call, 803-607-9677, if you've got anyone that needs any help at home, that wants to stay at home and not go to a nursing facility or assisted living. Give them a call, and they can help you out with anything from grants to legal help and things like that. But, Curt, we were talking about, and it's been a common thread for the show, talking about prevention. Mm-hmm. And that's kind of where we left the verbiage, right, the last segment. So if you'll finish your thoughts on that, and then kind of want you to, if you could, talk about the Smart Beat program, which has been around with your industrial wellness for quite some time.
Sure. Well, the concept of prevention resonates across many different levels when it comes to, the general welfare of a community. But, with specific regards to the industrial medicine and wellness facility, finding ways and developing avenues to help prevent things from happening in the first place. In the workers' comp world, typically what you're talking about is very low-profile orthopedic issues. Somebody sprains an ankle, somebody bangs their thumb, somebody does these sorts of things. And, sometimes despite your best efforts, those things are going to happen. But low back injuries, neck injuries, those sorts of things. From a rehab standpoint, we spend a lot of time taking a look at what people are doing. Are they doing it correctly in terms of their posture, in terms of their lifting mechanics, and really taking that paradigm and moving it onto a manufacturer's floor to say, hey, now listen, you've got this one particular area. Maybe you've had 2 or 3 back injuries that have come out of there, or maybe you've had a couple of cases of shoulder impingement. Here are some movements, or here are some poor mechanics that contribute to those particular conditions, and working with them in terms of pure prevention, because we've always been great at treatment. That's not a and when people come and see you, getting better is not the that's the rule, that's not the exception. So people work, whether you're in a hospital or private practice, that's what you're continuously working towards, to create more efficient and effective care. But now prevention is a little, it's in a different sandbox, but it's on the same playground.
Well, Chris, you guys talk about that all the time at Colonial.
Yeah, absolutely. We've had a couple of segments where we talked about risk prevention, and the number one cause of death in the United States is still cardiovascular disease. And I think one of the programs that Tuomey has, the Smart Beat, really hones in on prevention of cardiovascular type diseases. Mm-hmm. And again, getting a lot of these screening tests done can find problems early, and it's much less expensive to treat patients, and the outcomes are improved.
Well, Curt, talk about that. I know, Jeff, you and I have talked about the Smart Beat program kind of on a peripheral. Mm-hmm. Give us a little more in depth. Is that something that we sign up for? Well, first of all, let's talk about what it is and what kind of test are we talking about?
Well, it is a screening tool, and it is at ground level trying to help people identify things that could be, could be a landmine health-wise, could have just a intense sense of urgency to some of these things, and sometimes it's just things that need to be caught way before things get to that stage. But what it is a 4-part screening. We offer ultrasound studies of your carotid arteries in your neck, and what you're really looking for there is the absence or the presence, and if there's a presence, the degree of that presence of cholesterol plaque in the carotid arteries. Through ultrasound technology now, you can see that particular disease process in its very early stages. And the great thing about that is, if that information is relayed to the primary care physician, there are, science and technology really allows for great treatment and monitoring of those things to where they don't get to a critical stage. Cholesterol plaque in the carotid arteries, obviously, your chances of a stroke. There's several issues that arise from that. But the problem is, a lot of times people just don't know these things until a symptom arises. So ultrasound study of your carotid arteries. We also do an ultrasound study of your abdominal aorta. And there you're looking for the presence of a swelling of that vessel, also known as an aneurysm. And in that, there's some education, because when people hear aneurysm, you might as well tell them they got a gunshot wound.
Right.
But really, all that's indicating is that there's some swelling in that vessel. Now, the degree of that swelling is certainly something, of discussion. Once it gets beyond a certain point, it is just deemed an aneurysm. It has to be deemed that once it gets past a certain measurement. But if you're able to say, hey, listen, there is an aneurysm present, you need to follow it with your primary care. Those things are often monitored to the point to where they can be managed surgically if it gets to that point. And sometimes they're just managed for the span of someone's life.
Curt, only because of time constraints, let me ask you a series of questions. Is this something that you guys offer on a daily basis? So if somebody called up, or is this something that you do monthly?
We do it monthly.
Or a bus comes, or is it in-house?
We do it monthly,
and
we do it in the clinic setting.
Okay.
We originally designed it to be within an industry.
Okay.
So we made it very mobile, and we made it very quick, because we knew people couldn't be off the floor all that long. But the feedback from the general public said, look, we want this. So we decided to keep it in the clinic setting at 250 West Westmart Boulevard at the Industrial Medicine and Wellness Facility. We offer it monthly. It's typically printed, the advertisement for that, on our community calendar.
Does it come as you are? Do you make an appointment?
You make an appointment.
Okay.
There's a number on there. And also, one of the things that we do is a lipid profile, which it requires a blood draw. So we do them in the mornings because there's a fasting that's required. But we usually see anywhere from 15 to 20 people in a morning. It's very comfortable. Yes, it's quick. When people hear 15, or 20 to 25 minutes from stem to stern, that's kind of rushed. It's really organized in a way where people can ask questions. They can even see the ultrasound images.
Does insurance cover? We always get that question. So no insurance coverage.
Not.
What's it cost?
It is $110.
Wow.
It's $110.
So if I could either get that tested and just see how my heart and everything's doing, or I could go bowling with 4 kids. That's really right. In other words, it's very inexpensive.
It's extremely inexpensive.
And so enlightening for our prevention that we talk about so much.
Oh, yes.
Guys, time flies by. I want to thank Curt Ackerman. I want to thank Jeff Paul, as always. And I think we could take a whole show and talk about SmartBeat, which maybe we will. Yeah. Because I think it is so important to let people know all the things Tuomey's doing. Give Tuomey and the foundation a call. Jeff, what's the contact number? 774-9014. And get out, support that. Curt, thank you so much for doing it again. And again, everybody have a great weekend. All right, see you next week.